thank you all for being here tonight. I want to thank all of the practitioners who are the chi, the life force of Santa Fe Soul on a day-to-day basis. And I want to thank the community, too, for all of your blessings. I love challenges, and this is a big one, to talk about Chinese medicine and immunity. For many of you probably know this, but Chinese medicine is one of the oldest continuous systems of medicine / healthcare systems on the earth, over these last few years. So it's about 5,000 years old. And one thing that why I was attracted to this about 18 years ago, that's how long I've been practicing, is the hallmark of Chinese medicine is prevention. I love the fact that Chinese medicine is an integrated model in terms of looking at the whole. It's based in Taoism, one of the many isms that I really like. And Taoism has a lot to do with we're all knowing that, foremost, we're all connected. Knowing that the earth, that we're provided by the earth, that we are interrelated. And that in terms of our health, it's just not a matter of being concerned about a certain virus that's out there. It's about what are we doing day to day in a holistic approach. And that's what we're going to hear from our speakers this evening. But what are the choices that we are making 24/7 in terms of making good choices in terms of optimal immunity? But also when we think about healthcare, my whole talk is about any type of healthcare issue, how we want to prevent cancer, how we want to, which is now the #1 cause of death, diabetes, obesity, heart disease. All of these particular issues are rooted in, or the way in which we address it is an integrated model. That is the new medicine. We're bridging medicine, all walks, all ways in which we approach health and disease, that we need this approach. So in terms of Chinese medicine, there are many ways in which we provide health care. So herbs, I just want to start out by saying that the foundation of Chinese medicine really has a lot to do with herbal medicine, more so than acupuncture. There's at least 10,000 herbs that we use. But in terms of immunity, I have some here, and I started picking them out from my herbal pharmacy. There literally are hundreds. So I just want to say, work with your own doctor of Oriental medicine, naturopathic doctor, whoever you might be working with, but there are so many herbs that you can take. I'm really big on the first sign that your body gives you. We have this incredible innate ability to heal, but we need to listen when we get these messages, be it a sore throat, a headache, a slight fever. We got to jump on it right now. I mean, truly, in my 18 years of practice, the flu season is getting worse and worse in terms of what I'm treating. What we are seeing here at Santa Fe Soul, it's some of these, not just the flu, but a lot of these health issues are getting more and more serious, and things are happening really fast. So you need to address it. In Chinese medicine, on the most superficial, when you just get, again, if it's a sore throat, that's a superficial message of, I've got something going on. You want to get it before it becomes a cough, or once it's in the lungs, it's much more challenging to heal. I try to do everything possible with herbs and acupuncture. I also do IV therapies to prevent someone having to use an antibiotic. If someone needs that, absolutely. We know where to refer our patients at all times. So I just want to mention that you have many choices. There are 50,000 herbs worldwide that we can use for medicinal purposes. Acupuncture, as you know, is wonderful for any type of flu. We're getting lots of people, even this week, with coughs and slight fevers. I mean, nobody that we know of with the swine flu. Mind, body, spirit. This is a big part of an integrated model. And I wrote down there emotional immunity, to really think about what does that really mean. That is just as important as taking our herbs, as important as doing a lot of other preventative measures, is how are we running our emotions and our thoughts on a day-to-day basis. I mean, there's so much stress. We're going to talk about that more in depth, but that degrades the immune system more than you can imagine. I mean, people can just go directly into a state of any type of imbalance in terms of a disease. And Chinese medicine is really not so much focused on diseases per se. What we look at are imbalances in the body. We look at patterns. So even if the swine flu is out there, it's and we call an external pernicious influence. It's right up there with wind. How about the wind the last few days? How did everyone feel? Did you feel a little irritated? No, it's a serious pathogen. I want to tell you, it is really, really important. I want to recommend highly that you wear a scarf. men included, or a headband. I mean, in Chinese medicine, we have back here these 2 gallbladder points called the wind gate. It's a very vulnerable area in the body. And you're much more vulnerable to invasions in your system. I also want to say here in my talk that germ versus host theory, the germ theory is pretty much the past. I mean, we being so focused on the germ or the pathogen. I'm concerned about viruses. I'm concerned about bacterial. I get a lot of really strange fungal infections as well. But what I really want to focus on and what Chinese medicine is all about, and when I think about our integrated approach, how 25 practitioners work together, is the host theory. That you, again, getting back, I want to say this again, we have this incredible innate ability to heal. So I want to ask you all to consider being very proactive in how you're taking care of your body in terms of not being a host to a pathogen. Does that everyone follow me? Not everybody, the people who have, Chinese medicine is also based on healthy qi. The more vibrancy you have, the more vitality you have, equals you've got good qi moving through your body. So you want that. You want to have good qi. That means your cells, we have at least 70 trillion cells in our body. We want them all to be high functioning because we are as healthy as the health of our cells. So consider that rather than saying, I don't want to be a victim of this virus that's out there, you think about, I don't want to be a host. What am I going to do, again, 24/7 to know for sure that I may not get this? But again, it's challenging. It's more challenging now than ever to stay healthy. So food is medicine. Lisa will be talking about that shortly. But Chinese medicine is all about nature. And also the next area, Qigong, Tai Chi, in terms of movement therapy. We need to be outside. We need to be touching the earth. We are indoors way too much. And that is affecting our health probably more than anything. We are very proactive at Santa Fe Soul in terms of investing in technology that helps us with electromagnetic smog. I really want to say here today that I believe, and we're experiencing it right now, that is the real big issue, the 21st century healthcare issue is going to be electromagnetic smog. We can't necessarily smell it, we can't taste it, we can't feel it, but it is affecting all of us in terms of our nervous system, so getting back to stress and getting back to emotional immunity. If we have what's called our sympathetic nervous system, we have a parasympathetic nervous system. When that sympathetic nervous system is going 24/7, high five with our hair on fire, I mean, we are living this, without a doubt. So many people are just wired and tired, and that's what I feel in pulses. But that amount of stress is so debilitating. We cannot sustain this lifestyle at all. And so in terms of, again, being reactive, or that's fear, or being proactive, really important to think about that. But I also want you to consider, what it means to be a good citizen today. Anybody have an idea what that means? To be a good citizen is to eat processed foods, to take drugs, to not exercise, to not be your own best physician. We really need to take this personal responsibility. It's our responsibility. Then we take more drugs. And I just want to say, thank God they have their purpose. But in many cases, the drug companies are here to keep us sick, but keep us alive. But, it's true, if we are living longer, supposedly we're living longer, but we might be living 60 years with a chronic illness. So I think we need to ask ourselves, do we want to be managing our own diseases like in the next few years, or even right now, many of us in this room may be managing diseases, or do we want to be proactive and make positive lifestyle changes day to day? It matters in terms of our health of our families. It matters, to our community and to our world at large. So that's my message tonight. I just want to wish you all optimal health this season and always.